Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Talking about health insurance, even health benefits, or going to see the doctor is something that can make just about any one of us nervous. After all, we get hit in the pocketbook and we still seem to have the same ailments and no end in sight. In fact, healthcare costs, there's a possibility that patient care will probably crumble by 2025 when these costs just get too far out of reach, even prohibitive, and the physician numbers dwindle. Joining us here on the Beyond 50 radio program today is a doctor who started his practice back in 1953, so that means he's been in the system for several decades and watched the unbelievable changes that have happened to our healthcare system over the years. His newest book is Our Healthcare Delivery System is About to Collapse. It's time to wake up, America. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. Lindsay Pratt. Dr. Lindsay Pratt, joining us here on the Beyond 50 radio program today. How do you do, sir?
Good morning, or good afternoon.
Now, as I was reading your book, it's pretty alarming how the middleman basically squeezed his way into the middle, much like unions did during the manufacturing years of America. Let's talk about how this happened and when this all started.
Yeah, let me. It's very important that your listeners understand that. I had the opportunity to witness the many changes in healthcare, and one of those changes, which is very important, is the fact that during the 1970s and 1980s, physicians became professionally and organizationally dysfunctional. And by the 1990s, they had lost control of the healthcare delivery system. They lost control to the government, the managed healthcare industry with its HMOs and its multi-hospital management companies, and lost control to the health insurance industry. And the three of them changed the healthcare delivery system we had prior to the 1960s was a very patient-friendly delivery system, providing everyone their healthcare services, regardless of their ability to pay for them, into a patient-unfriendly, a politicized, and an insurance and profit-driven business system we call the healthcare delivery system that requires patients pay for the healthcare services before they receive them. It's a tragic situation, but the physicians have to assume a lot of responsibility for this happening.
When you take a look at the whole thing, too, and we've talked about this on the program many times, and usually I try to, with the knowledge that I have, try to suggest the best way for people to go about their health care coverage as well as management. And, you take a look at, for instance, that you have insurance that has now gotten in the way to such a degree that they actually have usually annual contract renewals with hospitals. Because basically what they're saying is, we've drawn in about 90%, give or take, of all the people that come to see you at this hospital, so now we're responsible for the income of the hospital. Now, of course, a hospital is just like a business, really, or at least that's the way they try to operate. But the fact is they get in the way, and then they tell people what they're allowed to do or not to do when they go see the doctor on top of it. And, I was somebody who, fortunately, we had a pretty good health care coverage for my son who got a really bad sickness that left him in the hospital for almost 4 months. And, there was a time when he had physical rehabilitation and they were balking at some of the procedures that needed to be done. And I just about, for lack of going in there with an axe and maybe a blowtorch, said, you guys will be paying for this because this is very necessary. We're not doing this because, it's just something we'd like to have done. And, to have to fight with something like that, it's like you've been paying your premiums and they're going to tell you what they will or will not pay for. And it's kind of ridiculous how all that happened. Now, the doctors were the ones saying, no, this needs to be done. But, when all of us are fighting against that, it gets pretty ridiculous after a while.
Well, you raised a lot of thoughts there in my mind. First of all, physicians have become employees. Physicians no longer have leadership roles in or control of the healthcare delivery system. And that's tragic. That is going to cause a physician shortage within the next decade. There's no question about it. When it comes to the cost of the hospital, I've been working in a hospital since about 1950 1953 or 54. And originally hospitals were community charitable organizations. And they had wards for patients who couldn't afford to pay for the health care services, and we doctors took care of those patients as part of our hospital responsibility. But then during the 1970s, the billions of free health insurance dollars flowing into the healthcare delivery system attracted a lot of business interests, and they developed what was called the multi-hospital management companies. If you look at all hospitals today, they're not owned by, it's not just one hospital, they're owned by several different hospitals, and they become businesses, and they employ their doctors now to provide the patients. And it's a shame because it's very difficult. If you don't have insurance today, you have a difficult time obtaining health care services. Even if you have Medicaid, you have a difficult time finding doctors willing to accept you as a patient to provide you the services. And now the government wants to get into this nonsense with a single-payer health care delivery system. That would just be tragic. I don't know if your listeners will be interested, but as far as I'm concerned, I had a lot of experience with this. Single-payer healthcare delivery system would absolutely destroy our healthcare delivery system. You know, there's an old saying, if you think things are expensive now, just wait till they become free. My point being that the government already manages 3 single-payer healthcare delivery systems. They manage Medicare and Medicaid. They have the Affordable Care Act, and now they're trying to get the single-payer healthcare delivery system. And in addition to the single payer, they have the 3 are the Medicare, Medicaid, the Indian reservations, excuse me, and the Veterans Administration. I'm sorry. Those are 3 single payer healthcare delivery systems they manage now. Well, each one of them has corruption, mismanagement, and waste. And so you just can't allow the government to come in and do that, which they will do. The only reason your listeners probably don't realize this, but the only interest the government has in healthcare is obtaining the political power of a public dependent on government for their healthcare services. These so-called insurance programs are nothing more than ploys to manipulate the public to get more insurance. And then the people who provide the insurance, like the government and the health insurance industry, make a fortune. When I started, you didn't have to have insurance. You didn't have to pay for health care service. And we've got to return to that. Otherwise, trust me, your listeners better really think seriously about this, because within the next decade, the whole system is going to collapse. Your health care service will become, the cost of the health care services will become unsustainable, and there's going to be a physician shortage. And both of those are going to cause a need to ration healthcare services, and it's going to come. And when it happens, you know what's going to happen, then the whole system will collapse. So you're getting back to the hospitals and insurance and so forth. It's tragic. We've made healthcare into a business system rather than a patient service system. And another thing which I'd like to bring up to your attention of your listeners, they probably don't think about this, but healthcare is not a business, and healthcare will not survive as a business. A business is a free enterprise system. In other words, a customer for my service, if I was providing a product in a business system, the consumer has the option of deciding if they want to buy the product, the option of deciding how much they want to pay for the product. But in healthcare, it's different. If I acquire a disease, I didn't want to acquire that disease, and I must pay whatever it costs to treat that disease. So you cannot consider healthcare as a business system. And therefore, I've written in that book, I think I mentioned in the book, about price controls. Price controls are so necessary in healthcare because as long as someone else is going to pay the expense of healthcare, then that person who pays that expense has to have some kind of control over the cost of the services they have to supply those to whom they have to provide those services. And so price controls are so important in healthcare. I could go into a lot of other things too, but I'll be taking a lot of your time. But
we have plenty of time here, believe me. So take your time and lay this out for people. So then that way we can come to a point where we say, okay, what then is available? What do we do about this? Now The thing is you mentioned some really great things, and I couldn't help but think, for instance, and it was a flash of the movie The Dallas Buyers Club, the true story of the man who created basically this membership system where you pay $500 a month. This was for AIDS people. And for that, you get all you want of these supplements, these, pharmaceutical-grade supplements that he was bringing up out of Mexico that was actually helping people reduce, AIDS itself, so they were living longer and even more healthy, And it was funny how then you had the FDA jump in and say, well, what this guy was doing was criminal. It's like, what part of he's helping these people get what they want don't you understand? Since you're not doing it here, he's got to go to Mexico to get this stuff, So, and it seems a lot of people are, scrambling across the borders to get out of the United States to do things that in the United States they are unable to do. And there's something wrong with just looking at that picture.
Well, take a look at healthcare costs. You talk to people about that; they don't understand it. We know why they don't understand it, because they don't pay the cost any longer. But let's just think about the cost of healthcare services. When I started back in the 50s, the patients were paying for their healthcare. They were reaching in their pockets for the dollars to do that, or reaching in their pockets for the dollars to pay for the health insurance they were using to pay for the healthcare services. And therefore, they were doing what? They were very cautious. I had many patients say, well, doctor, is that necessary? We rarely ever hear that today. But then the employers and the government's health insurance programs came along during the 1960s. And the free health insurance dollars that they were providing were taking the place of the patient's dollars. And what happened? Well, natural. It wasn't the patient's dollar any longer, so patients no longer were questioning the need for or the cost of the healthcare services they were receiving. Also, patients were using those free health insurance dollars to buy services they never considered purchasing when they were using their dollars to provide the same services. It's just been going on for quite a while now, and what they hold the business interest. The public doesn't know it. When I started in the 50s, it was just doctors and patients. Now you have all these business interests in healthcare. And those business interests have been making a lot of costly demands on those free health insurance dollars. And that's causing healthcare to increase tremendously. Another thing that patients hadn't really considered is the baby boomer. The poor baby boomer are what? They're seniors and they're patients with special health care needs. And those patients are the patients who've been creating about 70-80% of our health care costs. So what can you expect? Now that the baby boomers are increasing, health care costs are even going to get more expensive. So there's no question in my mind that the public has to anticipate the cost of their health care services will be unsustainable. They just won't. There's a projection I just saw the other day of 20%. Healthcare costs will be 20% of our GNP by the middle of the next decade. It's impossible. You can't afford that kind of medicine. That's all there is to it. Also, they talk about physicians. People don't realize there's going to be a real physician shortage. Physicians have become employees, and it's causing two problems. Every time I go to the doctor, they tell me about their problems more than about my problems. But nevertheless, I'm a practicing physician. Now I'm an employee. Well, I have now become a 9-to-5, 40-hour-a-week doctor. And if you have any problems otherwise, you raise up your telephone. If it's an emergency, call 911. It's a shame. These guys are also seeking early retirement. So replacing those doctors is going to be difficult. Why? Because I'm a student. And I say to myself, well, do I really want to spend 12 years preparing to be a doctor, to become an employee of the government or the managed healthcare industry or the health insurance industry? No, I'm not going to do that. I'm going to seek other career opportunities with equal opportunities, and requires less time to become that particular career, and have a smaller student loan. And look at the student loans. these students are looking at these doctors getting out of medical school with $150,000 and $200,000 student loan debts. It's ridiculous. And they're going to say, well, I'm not going to do that. It's too expensive. And then these poor souls getting out of medical school and looking for a job now, they're competing with a lot of foreign trade physicians. Now, I'm not being critical of foreign trade physicians. Don't misunderstand me. My point being that they don't have student loans. In their country, they receive either a less expensive or a free medical education. So now you have a doctor who trained in this country with a $200,000 or $150,000 student loan applying for a job and competing for the same job with a foreign student who has no student loan. The foreign student can accept less compensation for his services than can the American student with the $150,000 student loan. So the public has to be prepared that by golly, there's going to be a real serious problem getting health care in the next decade. It's going to be interesting. And what frightens me more than anything else is I see these poor young millennials with their tremendous debts and so forth. They're just attracted so to socialism. If they only knew what socialized medicine was like, it's another thing for your listeners. I'm sort of rambling here, but I think they're important points. Our government is so disingenuous in its reporting, particularly of the National Health Service programs in other countries. They never tell you that those countries are smaller than most of the states in the United States. And they never tell you that countries as large as the United States, like Australia and Canada, have populations less than 40 million people, or close to that anyway. In the United States, if you have a National Health Service, they've got to supply over 350 million people their health care services. Well, monitoring those services would be absolutely ridiculous. It couldn't be done. The chaos would be ridiculous, the corruption and so forth. So they're just disingenuous in what they're reporting. I just hope that the government never takes over health care. A friend of mine was just telling me the other day, I was talking to him about this, a doctor friend of mine, and he's retired too. And he said, Lindsay, it's just like the public education system. I said, what are you talking about? Well, he said, well, after World War II, there were people who in Congress who wanted to get an indoctrination process, and so they can get their means of how to govern across the people. And they accomplished their goal by establishing the Department of Education. Well, over a period of time, the Department of Education gave a lot of goodies out to public school systems, and those public school systems accepted those goodies. And all of a sudden, the public school system became dependent on those goodies. And now the government is telling the public school system what to teach and how to teach it. In other words, the government's intrusion into education has caused the demise of our educational system. You take when I was growing up, and I'm sure even 20 years ago, I'm not sure the date, but anyway, our students' achievement scores were one of the highest among industrialized nations. Now they're among the lowest of the industrialized nations. And that's all because of government interfering with our educational system. And I just hope and pray that the public does not allow the government to do that with our educational system, and they will. I hate to be so cynical, but I'm getting that way as I get older. Of course, I'm 93 now, so how much more can I go? But politicians are only interested in one thing: power, and they don't really care about the person as they do it. I could ramble on other things too, but I'm sure maybe. Oh, one thing I'd like to go over with you is this alternate healthcare delivery system that I recommend in my book. I think it's so important for the public to understand that. There are 6 ways you can reduce healthcare costs by at least 30%, and 40% is could be a realistic expectation. And that is, 1, to get rid of unnecessary healthcare services. At least when I retired, I was the medical director of an HMO for a couple of years, and I found out at least 30% of the services my patients our HMO enrollees were receiving were medically unnecessary. Now, a lot of those services were medically unnecessary, yes, but the doctors were giving those services because they were afraid to get lawsuits. In other words, It's not what they did; it's what the attorney can convince the jury that the doctor did not do. So a lot of the services are medically unnecessary. That can be solved. It was solved years ago. We can do it again. But to do that, you have to change the legal system. The legal system in our country is destroying a lot of things. It's out of control, as far as I'm concerned. I'm a physician, and I was sued 4 times. Now, 2 of them were thrown out in deposition, and 2 of them went to the court, and the jury said within half an hour I wasn't innocent. They were ridiculous. But there's no way to stop it. Why? Because if you want to sue me, Mr. Davis, you can. But it won't cost you a nickel to sue me. But I have to hire an attorney, and I have to hire other defense costs to defend myself. And when I win my case and prove I was innocent, I can't recover any of my defense costs. So what we need to do in healthcare, and that's part of the second part of my program, is change healthcare litigation. As far as I'm concerned, we need a law called the loser pays all law. That's in other countries have it. Why don't we have it? In other words, Mr. Davis, if you sue me and I win, you got to pay my expenses. That would stop 60 to 70% of our healthcare lawsuits.
Yeah, I agree with that. It could stop a lot of lawsuits too.
Oh yeah, and I agree. And another thing I want to do is change the jury selection process. I testified 3 or 4 times in my career for other doctors, and I was talking to a lay jury. They're not even first-year medical students. They have no idea what I'm talking about. So we have to change the jury system. If I'm a physician and I'm going to be sued, I want to be judged by a jury of my peers. And it's not the way the system works today. And it has to change too. But anyway, if we did that. Now, the other thing, as I mentioned about the unnecessary services. Oh, the next thing is doctors' fees and so forth. I won't go into a long story about that, but a lot of them are absolutely ridiculous now. And back in the 80s, we had something called the provider reimbursement formula introduced. And it was a standard by which doctors' fees could be established. And one was the length of the time the service was provided. Well, most all services, we know how long it takes to do them. That's easy to recover. The next thing was that doctors received a salary for their job. That, oh my goodness, that just caused an awful lot of trouble. But and the other thing was, as far as I'm concerned, I was a surgeon, but my friend who was an internist just spent just as much time as I did learning, and he required just as much skill as I had to be a good internist as it was for me to be a good surgeon. Therefore, why did I get paid more for my services than the internist did? It doesn't make sense. And the provider reimbursement formula didn't take care of that. It took care of that and did. And it gave the same thing to all doctors. And the third thing is the overhead expenses. Now I know different doctors have different specialties requiring different overhead expenses, and different regions of the country have different costs and so forth. But that's all taken care of in the formula. But the formula received absolutely no support and was declared a price control. And I mentioned to you earlier, price controls are appropriate in medicine. They're very important in medicine. And as long as somebody else is paying the bill, you have to have price controls. The other price control would be to make the patient pay for the bill, and that's another part of my program, or mandatory co-pays. If you have a patient paying 30% of the cost of their service, you'd be surprised how few services would be offered and accepted by the public. And the last thing was my replacement of Medicaid. Medicaid is a ridiculous thing. It was a political document just to require more people become dependent on government for the health care services. A lot of people couldn't get Medicaid and can't get Medicaid. So it doesn't help all people. However, you replace that with what we had before, but we changed it. And I haven't got time to describe it here, but they're state-sponsored HMOs, I guess that's what I'm looking for. Patients are assigned to a certain facility, free facility in the community, like they're assigned to an HMO. Then the doctors are employed by the HMO, and the patient is assigned a doctor within that HMO. and that makes expenses less expensive, because Medicaid patients have no one responsible for the cost of the services. That's why they have so much corruption and profiteering in the Medicaid system. Excuse me. But the program that I'm proposing is I lost my train of thought there for a minute. Talking about the good Lord, here I go again. I'm getting in 93. I'm not as clear as I used to be years and years ago.
Understood.
But the Medicaid patient. With my system, the patient has an assigned physician in the assigned facility responsible for their health care services. Therefore, you don't have the abuse that you have now in the Medicaid system. It's a wonderful system. It's very easy to adopt to. But again, you encounter one problem. Too many people are making too much money with our present system to make any kind of a change. It'd be so difficult to make changes in our present system until it collapses. When it collapses, then it'll change. But unfortunately, it has to collapse before it changes. Any thoughts you have, or if I could expand on before I?
No, continue. You're doing just fine.
Go on. Yeah. No, but I'm just concerned about it, and I think the public needs to be concerned about it. And they've been duped by the government for such a long period of time about the need to have health insurance. When I started, no one had health insurance except the health insurance they bought for themselves. And it was a big joke after, we'll say in the, I'm going to say go back to the 60s, maybe the early 70s. The big joke, what's the indication for an operation? Blue Cross and Blue Shield. That's being a little bit facetious, but it was true. It was terrible. You'd be surprised how operating rooms got more busy as people developed hospital insurance. It's just terrible. It's terrible what's happening to our healthcare delivery system. Well, I'm kind of exhausted. Go ahead. Any questions I can ask you have right now?
No, you pretty much covered what needs to be done and what people should be considering. And I'm curious, do you have a website people can find out more about your work?
No, I tell you, I'm 93 years old, and I just wrote that book out of frustration. And I just hope that somebody reads it and realizes what's going on, how they're being manipulated, by the government and by the many special interests, the many special business interests in healthcare. They never existed until we had health insurance, and they're profiting from the health insurance. It's ridiculous. And the public doesn't give a darn because they don't pay for it anymore. That's why I want mandatory copays. You know, see, my generation went into medicine because back in the old days, doctors didn't make a lot of money. We wanted to be doctors, and we took it. When I think of all the people I operated upon free back in those days and took care of free, you can't get into a doctor's office today unless the first thing they say you have insurance. It's just terrible, As you can tell, I'm very upset by what's happening to my profession. I loved it. It was a wonderful profession, and it treated me very well too. And But the doctors today don't enjoy practicing medicine like they used to, because they're just told so much how to do it, and what to do, and you can't do that, you can't do that. Insurance won't pay for that. Insurance won't pay for this. It's just ridiculous. Just ridiculous.
Well, I want to thank you for being on the program today to share this with our listeners. And again, they can find out more, get a hold of the book. Our healthcare's delivery system is about to collapse. And I'd like to thank you, Dr. Lindsay Pratt, for joining us on the program today.
Well, thank you very much for having me. I think it's an important subject. People better awaken because they're going to be the losers. They're going to be the losers.
Right. Thanks again for being on the program today. It's been a pleasure.
Bye-bye.